Hello, and now we're going to discuss about bed making. So, as caregiver, we are responsible to make our patient comfortable. So, we need to do bed making. And what is bed making? Bed making is the technique of preparing different types of bed in making a patient's or client's comfortable or his or her position suitable for a particular condition. So, let's define some terms so we'll fully understand about this topic. So first is fan folding or fan fold. Fan fold is specifically folding the edge of the sheet used in the bed 6 to 8 inches outward. So later on, fan fold, I'll show you how to do fan folding. Then mitered corner, means of anchoring sheets on mattresses. So toe pleat, it is a fold made in the top bed clothes to provide additional space for patients' toes. Then foot drop, plantar flexion of the foot with permanent contracture of the gastrocnemius muscle and tendon. So foot drop is happen when the patient is bedridden and having this always covered with the bed sheet, so the leg will be permanently dropping, okay, because the bed sheet will always touch the, or the blanket and bed sheet will always touch the foot, so it will be having foot drop. Then bed cradle, it is a curved semicircular made of metal that can be placed over a portion of the patient's body. So later I'll show you what is bed cradle. And hospital bed, usually it's about 26 to 28 inches centimeter above the floor. The ideal hospital bed should be selected for its impact on patient's comfort, safety, and medical condition, and ability to change position. So what are the purposes of bed making? First is to promote client's comfort. Then it provide a clean environment for the clients. So if you are having clean environment, it will prevent the patient from having an infection. Then to provide a smooth, wrinkle-free bed foundation to minimize sources of skin irritation. If your bed sheets are smooth, wrinkle-free, okay, it will prevent the patient from having skin irritation, because having skin irritation might lead to pressure ulcer. So we need to prevent this. To conserve the client's energy and maintain current healthy status, to prevent or avoid microorganisms to come in contact with the patient, which could cause tribulations. We have two common types of bed, okay, that we will do in our demonstration. We have the occupied and we have the unoccupied. Unoccupied means there is a patient on it. You're doing bed making while the patient is in the bed. Unoccupied, you're doing bed making without the patient. So we have types of unoccupied bed. We have the open bed, we have the closed bed, and we have the post-operative bed. So what are the kind of linens we're using in the bed making? First is the blanket. We have the top sheet, we have the draw sheet, we have the bottom sheet, we have the rubber sheet. So blanket, usually it is a large piece of cloth, often soft woolen, and it is used for warmth and as a bed cover. The top sheet, it comes after the blanket, and then top sheet, okay, it will provide also warmth, but it is not as thick as the blanket. Cotton draw sheet, this is used for the moving or lifting patient. Then bottom sheet, it is the down part, okay, the first layer of the sheet used to cover the bed after mattress cover. Rubber sheet, it is usually used to protect the bottom sheet from sooting due to patient secretions and preventing the patient from bed sore. Rubber sheet is only used in the Philippines nowadays. They are removing the rubber sheet. They are now putting the incontinent pad. So this one, if you're having test the certification, okay, they will ask you about rubber sheet. Okay, in the Philippines, they are practicing the the traditional way, so they are still using the rubber sheet. But now in other countries, they are not using the rubber sheet because it's hot and it will make the patient sweat. So that is the kinds of linens. So we have guidelines in doing bed making. First is you always wash your hand. Okay, before and after the procedure, you need to wash your hands to prevent you from contaminating the bed or from having the disease. Then hold soiled linen away from your uniform. Don't put the linen, okay, next to your uniform because it will be soiled. So make sure that it is away from your uniform. Linen for one client is never placed on another's client's bed. Remember that. You don't place, even if it's clean, don't put a linen of your patient to other patient's bed. Place soiled linen directly to the hamper. Hamper is the container of the soiled linen. So please don't put it on the floor. Put it directly to the hamper. Do not shake the linen. It's a no-no. Never ever shake because you're shaking all the microorganisms and you're giving it to other patients or patient's bed. Then, when stripping and making a bed, conserve time and energy making up one side. If you're only one caregiver and doing a one and you're doing bed making, okay, first you start with the first side and then go to the other side. So you will conserve energy and you will conserve energy. And always make sure that when you're stripping or when you're checking the bed, you need to check if there's any valuables or any important items that is in the bed. Okay, most of the patients, they are putting their money, their jewelry under the pillow, so make sure that you did not include those items on the portable hamper. Okay, so you need to check every time. Then avoid unnecessary trips to the linen supply. So how you'll do that? Of course, you need to gather all the linen, so to prevent from going back to the linen supply. You need to use also microorganisms are found everywhere on the skin, on the articles used by the client, and in the environment. So infection control is very important. Washing of hands before and after the procedure, so it's very important to prevent transmission of infection. A safe and comfortable bed will ensure rest, sleep, and prevent several complications in bedridden patients. So make sure that the bed or the linen will be wrinkle-free and it is smooth to prevent skin irritation. Then you should also provide a good body mechanics, okay, to prevent you from having back pain or back aches. Okay, make sure that you're always bending your knees, not your back. So these are the equipments we need in our bed making. We have the large flat sheet, okay. We have one fitted sheet, okay. If it's applicable, one fitted sheet. We have draw sheet, blankets, bedspread, pillowcase, linen hamper, this one, bedside chair, waterproof protective pad, disposable gloves. So So these are the linens that we're using. We have the mattress pad, this one. We have the bottom sheet or the rubber sheet. Okay, so the bottom sheet is this one. Bottom sheet can be bottom sheet can be uh, a flat sheet or it can be a fitted sheet. So this is rubber sheet, okay, which is placed after the bottom sheet. We have also draw sheet. So this is the draw sheet. Then we have the bed protectors or the incontinent pads. So this is the one I told you for the replacement of the uh, rubber sheet. So this is the incontinent pad. We have the top sheet. Top sheet is always flat sheet. Okay, it will provide warmth made of thick cotton and then thermal material. So this is the flat sheet. And we have the blanket. Sometimes we are putting bedspread. Bedspread is used just for a decorative touch to the patient's room. Okay, and we have the pillowcase. Okay, so the sequence of the linen will start from the bottom sheet. Okay, just write it down. You have the bottom sheet, the first layer. Then, if you're using the TESDA, if you will have TESDA certification, okay, you use the rubber sheet. Okay, for TESDA, you will use the bottom sheet, then the rubber sheet, then the draw sheet, then remove the bed protectors during the TESDA, then you have the top sheet and you have the blanket. Then in the current setup, what we are using and what we will do in our demonstration is first you put the bottom sheet, next is the draw sheet, then the bed protectors, then the top sheet, and then the uh, blanket, and then the pillowcase. Remove the bedspread. It's not a requirement. Pillowcase. So that's the sequence of the linens that we will be using on the occupied and unoccupied bed. So we have other bed making supplies. We have the pillow. We have the bath blanket. Bath blanket is used to provide privacy while we are positioning the patient or transferring the patient. Then pressure relieving mattress. So this is the one. So this one, it's also called as air mattress to prevent bed sore for those patients who have a high risk of having a bed sore. We have also bedboard. It is a piece of wood that is placed under the mattress to provide extra support. Then we have bed cradle. So this is a metal frame that is placed between the bottom and the top sheet to keep the top sheet, blanket, and bedspread away from the person's feet. So this is the bed cradle. So that the sheet will not touch the legs. Okay, it will be, they will put the bed cradle. Then the footboard, it is a padded board that is placed upright at the foot of the bed. So this one. So to prevent the contracture or foot drop, okay, they will place a footboard so the leg or the foot will keep on its neutral position. So I told you about the guidelines. We have to always wash our hands. We need to hold the linens away from our uniform. We need to collect all the linens, okay, completely. Then place the clean linens in a clean surface. Wear gloves when removing used linens from a bed. And roll the linens toward the center of the bed to confine the soiled area inside. Okay? If body fluids or substance leak through the linens to mattress frame, wipe it with a disinfectant. Okay? Always clean the bed. If you're removing a dirty linen, we will clean it with disinfectant wipes. We need to always place the linen on the bed. We should always place the seams of the sheet face away from the client's skin. Okay? Face away, it means the seams, it should not be touching the patient because it will cause skin irritation. So, we will always prevent the bad side or the seams of the sheet, okay, touching on the patient. Linen should be always changed whenever they become soiled. Do not shake any linens. When you need to change the linens or person's bed, always be sure to explain what you're doing so they will cooperate. And take reassuringly to the person, even if the person is unconscious, you think that the person cannot hear you, close the door and always provide privacy. Then check the bed linens for personal items. As I've told you, we don't know there is any important items on the bed, so we need to check before removing it. And follow principles of body mechanics. What are the principles of body mechanics? Always lift, okay? Always lift an object closer to you. Dapat lagi siyang malapit sa'yo. Then, you need to bend your knees, okay? If you're reaching an object on the floor, make sure that you bend your knees, not your back, because it will put a strain on your back. Okay? Then, if you cannot lift any object, okay, you ask for help. Help. Then, you tighten your abdominal muscles. If you're lifting any object, okay, you put the pressure on your abdominal muscles, not on your back. Okay? And then, you broaden. You always move your feet apart uh, if you're lifting or if you're lifting an object. Okay, so to broaden the base of your support, you move your feet apart. So these are the principles of body mechanics. We have two types of bed, as I've told you, occupied and unoccupied. So unoccupied, we have occupied and unoccupied. We have the open bed, we have the closed bed, we have the post-operative or surgical bed. So we'll be posting a video about this.